Tonight, Bombshell claims that vital information which could help in Australia's fight against domestic violence has been suppressed by the very people tasked with tackling the scourge. Politics potentially undermining the battle to save lives.
For nearly a decade, we've heard variations on the same message.
Violence against women. Let's stop it at the start. Violence against women starts with disrespect.
Multi-million-dollar government campaigns aimed at ending violence against women, based on what was thought to be best practice.
Ending violence against women starts with gender equality.
But more than 10 years after government-funded organisation Our Watch was first tasked with tackling the issue, violence against women has been labelled a national emergency. And today, claims of a cover-up.
What really shocked me was the idea that you would ever delete evidence.
That's criminologist Michael Salter. In 2014, Michael was tasked by Vic Health with researching the drivers of violence against women to inform Our Watch's national strategy. His findings that both alcohol and poverty increases the risk of violence.
I was asked to remove those sections from the report, which I was really surprised about. When we're trying to prevent gender-based violence, we want to use all of the available tools in the toolkit. We don't want to hamstring ourselves by just deleting evidence.
Unfortunately, I wasn't surprised to hear that this research on alcohol had been removed. I've seen the way that alcohol lobbyists and companies work their way around the country, trying to make sure that any action to prevent or reduce the harm from alcohol never sees the light of day.
Australia's national strategy has focused on gender inequality as the root cause of violence, teaching respect the solution, changing attitudes the way to get there.
Doesn't she know that's just boys being boys?
Issues like the impact of poverty and alcohol labelled as reinforcing factors that can make violence more frequent or severe rather than causes.
I think unintentionally what that has meant is that anything else that's put in the other factors bucket has been disregarded or minimised or excluded from discussions.
Today, more experts are calling on the government and Our Watch to rethink their approach.
Governments have the information before them. Whether they're including it in their reports, frameworks or not, we know that men are more likely to use alcohol at high risk levels. We know that when men are intoxicated, they're more likely to harm our partner. Changing attitudes is necessary but not sufficient in changing behaviours.
The CEO of Our Watch, Patty Kinnersly, has been good enough to join us now. Patty, this report was quite a bombshell. Did Our Watch know about the suppression of this research?
I don't know of any evidence around those claims. What I can say, though, is that we're very much aligned with the importance of addressing the harmful impacts of alcohol if we're to prevent violence against women in this country. We work to a national framework called Change the Story, and it draws heavily on national and international evidence base, including that around alcohol and its impact on violence against women. And in Change the Story, we actually have a key recommendation about regulation of alcohol.
Right. It's interesting, though, because what Michael Salter is saying is that when he presented this research to Vic Health, they basically said, we're not interested in that. Then he went to Our Watch. He says multiple times about the exclusion of the research and that his complaints about that or concerns were ignored. Is that true?
I don't have any evidence about those claims. What I do know is that alcohol does feature in Change the Story and in the national evidence base. The evidence is really clear that the gender drivers are the most likely predictor of violence against women. So sexism, harmful gender stereotypes and disrespect. But importantly, we also appreciate there are what we call reinforcing factors that amplify or make worse violence against women. Alcohol is one of those, and it features heavily in our work.
So Salter talks about alcohol, but not just alcohol. He talks about alcohol and poverty contributing to domestic violence. That was a very clear point he made. How much do you believe alcohol and poverty together affect the rates of domestic violence?
Look, we all agree that alcohol and poverty are socioeconomic factors are a part of the story and an important part of the story. So we work closely with people in those areas of expertise so that our strategies align. We very much know that that work needs to be done if we're going to prevent violence against women, and so by working together, the sector has got the best chance of preventing violence against women.
You're right, Patty. I think we all want the same thing. We all want to end this violence against women. But the figures show that we still are losing too many women to domestic violence. Do you think Australia's national strategy needs reworking?
I think what's important with any evidence base, regardless of the issue, is that we keep evolving and we keep doing that as a sector, and we're really committed to that, not just Our Watch, but people doing prevention and response and early intervention and policing right across the country. If you think about 10 years ago, we couldn't possibly have predicted the impact of the online environment, so we're having to change the evidence all the time, and there's no doubt that no one is happy with the current spike in violence and the murders of women allegedly at the hands of men. So we're all working as hard as we can to reduce that number.
Patty, thank you very much for your time.
Thank you.
We did contact Vic Health, of course, at the centre of that story, and they said this, quote, "We know that violence against women is a complex issue with many contributing factors, including gender inequity. Vic Health has a long-standing role in advocating for policy reform to reduce harm from alcohol." Their full statement, if you'd like to read it, is on our website.